Hello everybody, welcome to the channel. We have a lot of new subscribers, a lot of new people watching these videos. So before we get too into things, I need to reiterate that I am the father of 3 autistic boys. Wonderful boys. Now, you might not be able to tell by these pictures that they have autism, but we'll get into that a little bit. I'll also show a little bit of footage of some of their behaviors or some of their autistic traits. I'm not really sure what to call this video yet. Obviously, you'll see the title, but something to the effect of a way to really know that you have autism or a loved one has autism. Now, I need to be careful with that because really, and this is my belief, I think you should get a professional diagnosis. If you get anything from this video, if you're in doubt, if you have serious concerns, please seek out a professional autistic diagnosis from a psychologist or a neurologist or a social worker or a doctor who knows what he's talking about or she's talking about. Please seek out a professional. Okay, that's the best route to go in life because you'll find a lot more help with therapies, with individual education programs, with government paperwork, all kinds of things. So with that out of the way, let's talk about a nearly surefire way to know that someone has autism, okay? Now, I made this highly scientific graph here, as you can see, or soon to be. It's not even a graph. It's more like a rows and columns thing. But basically, what I want you guys to remember is FCC, and not the government FCC. They pretty much have stolen every 3-letter acronym out there, right? I want to talk about frequency, consistency, and combination. So what do I mean by that? So we get a lot of comments from people who are like, yeah, I do this thing, but I'm not autistic. Or some people will say, well, I don't do any of these things, and yet I'm autistic. And it just kind of runs the gamut, you know, where people will have an attribute, or maybe they had one when they were a kid, and they're like, well, I don't understand what you're saying in your video because you're saying someone has this trait that they have autism. Well, not so fast. It's a combination of those traits that are very frequent and are very consistent. Now, these two things sound similar, right? Frequency and consistency. But why I have them separately is because frequency, we're talking about in the very short term. So like within the span of minutes, how often is the behavior, right? So let's take hand stimming, for example, like people moving their fingers or, you know, clapping their hands, things like that. Are they doing it very close together, the frequency? Or is it like, you know, maybe this, and then a couple minutes later, they clap their hand a little bit? You know, that's what I mean by frequency. So if the behavior happens a lot closely together, that's high frequency. Consistency, we're talking over days, weeks, months, and years, okay? So if there's a behavior that only lasts maybe a couple of minutes and then you never see it again, or maybe you see it, you know, once or twice throughout the year, is that really something you should be concerned about? Probably not. It might just be a developmental thing, might be your kid just trying something new or different. I remember when I was little, I tried walking on my tiptoes. Now, generally speaking, walking on tiptoes is associated with autism or other neurodivergent behavior. So does that mean that I had autism? No, I highly doubt that I have autism, but I did walk on my tiptoes. So that's where you have to kind of go in. So I'll just give you an example. Like we'll talk about tiptoes, for example. My boys, all 3 of them, and they vary in age. Right now, my boys are ages 7, 11, and 14. And ever since they were little, they walked on their tiptoes. They still do it to this day. My oldest son, 14 years old, still walks on his tiptoes. Now we try to get them to walk flat-footed for their development, for their muscles, so they don't have as many physical issues later on. But I'm not going to get into any of that. I'm just saying that they walk on their tiptoes. It's been consistent in terms of the frequency has been every day. And they've been doing it their whole lives. So it's very, very consistent. And does it happen in a combination? And this is what usually I think trips people up is they notice a behavior and they're like, yeah, it's kind of concerning to me. I think my loved one might have autism. I don't know what to do. They start freaking out. They ask me or my wife, you know, does my loved one have autism? First of all, we don't know your loved one. I'm sorry, unless we see video, unless we see lots and lots of, I guess, evidence that's compiled over time, it's very hard for us to do a very on-the-fly diagnosis. And you shouldn't accept our diagnosis because really, you know, we're not there for your loved one. So again, you know, seek professional help. But yeah, this is what really usually trips people up is the combination. What do I mean by combination? So combination means a combination of factors, right? A combination of autistic traits. So just having toe walking alone or walking on tiptoes alone, I don't think is enough to be concerned about. If you combine that with poor eye contact over time, if you combine that with stimming or self-stimulation, like finger movements, rocking back and forth over time, if you combine that with needing sensory input, like strong sensory input, like maybe compression or a weighted blanket, and you combine that with maybe, rejecting certain sensory input, like they hate loud noises or, well, everyone hates loud noises, but they hate specific noises or certain smells that are really egregious to them over time, right? Very consistently, because, well, I'll put it to you this way. There's certain textures, right, that autistic people like and they gravitate towards, and it's very frequent, consistent, and combined with other things very much over time. Now, you have to be careful with stuff like that because as a child and as an adult, my whole life, I have hated when people rub their hand on carpet or their hands on carpet, especially that really scratchy Berber carpet. I hate that stuff. And every time I see someone do it, they rub their hands over carpet, I kind of get nasty chills up my spine. I don't know why. I just don't like the texture. Never did. It's kind of like nails on the chalkboard for me. Again, that doesn't mean I have autism. It just means that that particular thing bothers me. With autistic individuals, it's a lot of things, a lot of factors that can bother them. And so that goes back to the combination thing. So you go through, and you can see what I'm doing here. Let's say poor eye contact. If you're talking to an autistic individual and throughout the conversation, they're just kind of like dodging your eyes. They're not looking at you. They're looking all over the room, or maybe they're looking at your forehead because that's what they've been trained to do. Is it consistent? Do they do that every time you talk to them over the course of weeks, months, years? And then a combination of factors. Do they do it with other things? Are they stimming? Are they rocking? Are they having a hard time paying attention? And this is difficult too because it could go into overlap. Like sometimes it could be OCD, it could be sensory processing disorder, it could be ADHD. So you have to find autistic traits that are common among autistic individuals. And I think that's where people get tripped up too, because they're like, my kid has trouble paying attention. Does that mean they're autistic? Well, not exactly. I mean, maybe they are, but maybe they have ADHD, or maybe they just have a hard time staying focused in class. Maybe they've been on their electronic devices for too long and they've gotten used to that form of education, that sort of stimulation. And then they go to a classroom where there's just someone talking all the time and they're just bored out of their mind. It could be a lot of things. So again, that combination of factors going into things. The list, it goes on, right? Another one could be speech delay, or maybe they're more nonverbal. Does it happen every day? They're not talking, right? Over the course of weeks, months, and years, still not talking, and have very, very difficult problems with speech, kind of like I just did then. And then is it combined with other things, right? And you go through the list. So I think this is generally a very good way to start to build a case for, does your loved one or do you have autism or not? And again, this isn't 100% ironclad diagnosis. I wouldn't freak out too much if maybe there's a couple of things that are consistent over time. When it starts to build into 4 things, 5 things, 6 things, and so on, that's when I think you should start to be concerned and start to seek professional help. If there's these, multifaceted layers of issues that your loved one is exhibiting that are typically autistic traits, then yeah, I think you need to start looking into getting help for that individual. And I also hope this helps with a lot of people who maybe are not autism deniers, but people who deny that their loved one has autism and they don't get help for them. So they are essentially denying that there's anything wrong with their loved one. And this can cause a lot of problems in their development, especially throughout their life. And, there's just some people, for us, when we found out that our oldest had autism, we were kind of in denial. You have that tendency as a parent, like, oh, not my genetics, there's nothing wrong with us. But yeah, maybe it's a genetic thing. Maybe it isn't. We don't know yet. We don't know the missing link to find out what causes autism, although there's a lot of theories out there, don't get me wrong. But we just still don't know absolutely how to pinpoint it. And because of that, it's very hard to, let me put it to you this way. When someone has a brain tumor, it's pretty much ironclad, right? Either they have it or they don't. They get MRI scans, blood tests, things like that. And I'm not saying autism is a disease. I'm not saying that's comparable. But what I'm saying is it's a very clear science, right? Generally, either you do have a brain tumor or you do not. It's very binary, either or. With autism, it's kind of like a score sheet. You tally it up. And the more, tick marks you get, the higher chances of autism are present. So yeah, I hope that's helpful. But yeah, we get so many comments and questions about like this trait or that trait. And, I don't have this. Does that mean I'm not autistic? I do have this. Does it mean I am autistic? And honestly, I think this is probably the easiest way to go through and discover if autism is present or not. So yeah, again, be very careful with this, okay? Because when I was a little kid, I used to line up my cars in a row. And one of the autistic traits is stacking blocks or lining things in rows and stuff like that. And if you see your kid do that, I mean, don't freak out. Maybe they're just trying to organize things and trying to figure out spatial awareness and how things can be grouped together. It's not necessarily a sign of autism. If they are obsessed with it and if you pull them away from it and they start freaking out, then okay, maybe there's some room for concern there. Another thing too is the difference between cannot and will not. So with an autistic person, maybe they go to the shopping market, right? And you're getting some food and they start to have a meltdown. And you're like, is this autistic or are they just having a temper tantrum? Well, is it something that they can stop, a behavior that they can just cut off? So something they will not do. Or is it something they cannot do? You take them out of the situation or you give them whatever they wanted. Not that you want to encourage bad behavior, but you're trying to find out if this child is indeed having a genuine meltdown, a sensory meltdown. So you're moving from the situation, you get them calm, they're still melting down, they don't care what other people think. Chances are a lot more high, a lot more probable that was caused with sensory related issues rather than just, I didn't get the toy or the sweetie I wanted. So yeah, always look for that cannot, will not. I hope that makes sense. So with autistic people, they cannot do certain things versus a neurotypical person who will not do certain things. They have a choice in the matter. And that should clear up a lot of things too. So yeah, thank you for watching the video. I hope that cleared up a lot and didn't muddy the waters. Let me know what you guys think in the comments. And if you have any other ideas to help sort out if someone has autism or doesn't have autism. So far, this I think is probably the easiest way, you just on the fly to go through and find out. There's plenty of resources online too, so be sure to check those out. And they'll go through the different traits of autism and you'll see different ones depending on the site you go to, you'll see different traits attributed to autism. It doesn't mean that some are right and some are wrong. It just means that some sites are more comprehensive than others. And so, yeah. Again, thank you for watching. Thank you for subscribing and supporting the autism community and autism education. And we'll see you in the next video.